Hi, my name is Dexter Cumberbatch, and today we're going to discuss one of the most important topics that people, I'll say, don't think about when planning for retirement, and that is medical costs. Sadly, healthcare costs continues to rise, and most of us are living longer, so it is important to plan for future medical expenses. If you don't, it could have a big impact on your retirement savings later. I'm Dexter Cumberbatch, Retirement Education Specialist with Voya. I am also a registered representative of Voya Financial Partners. And over the course of the next 25 minutes or so, 25, 30 minutes, we are going to cover four essential aspects of, I'll say, medical expenses and ways you can manage that. For one, we'll be talking about how to understand the cost, your options for coverage, and then we will explore how to essentially pay for it. And then I'll be from there talking to you about how to essentially plan for that cost. So let's dive in. And I want to start with a question of my own to everyone that's here in this webinar, because I like to know like how much do you think healthcare will cost when you are in retirement? And I'll invite everybody to take a wild guess. It might be more than what you think. I'll tell you, research shows that an average couple retiring at age 65 today can expect to spend nearly 413,000 on healthcare expenses. This is throughout their retirement. And granted, one would spend roughly half that if single. And of course, this number could be different for each of us. But for a quick view of what to expect, I will encourage you to log in into your retirement account, into your ABA retirement funds account, and check out the My Orange Money experience. It does have a feature there that allows you to consider healthcare and the impact of healthcare costs on your retirement. Now, let's talk a little bit more about how much you should budget for when it comes to healthcare expenses in retirement. And again, for let's assume that uh, you're a single person, and let's say a single person will need half the amount that you see on my screen, right? It is important that this doesn't factor in assisted living or even nursing home care. So, of course, this number is variable and it's highly dependent on every one of our circumstances, such as age and health. So here, for example, if you have a chronic disease such as diabetes, your cost grant will be higher. And if your income is above certain levels, your Medicare premiums are going to be higher, which we will discuss later on. But the message here is, as you see, as we consider these different costs, right? We have to account for hospital coverage. That's one major cost. Medical coverage that costs money, deductibles, co-insurance, prescriptions. And I tell you that the message here is that even if you have Medicare, you will have out-of-pocket expenses over your lifetime in retirement, and you need to figure out how you will pay for them. So simply you cannot ignore them. That's why this talk today. That's why we are here, and this talk is timely. So let's talk about some of the facts. You might be thinking, well, I'm healthy, I'll be okay. But we have been living, life expectancy has increased. We have been living much longer, and living a longer, even healthy life is, as you know, expensive too. Longevity, staying fit, and having regular checkups, they cost money. Plus, also women live even longer and will spend more on health-related services throughout their retirement. In fact, on that note, for the women here in the audience, this is very important. You need to think about planning now for how you would pay for medical care and live and assisted living as you may be looking at living maybe, let's say, 25 years after you retire, 25 years or more. and well, for some of you even longer. And if you're married, you need to make sure you have adequate coverage in the event of death or divorce. Now, costs for life insurance, supplemental health insurance, and long-term care policies may increase the longer you wait to buy them. So it is smart to think about these things now especially while you're healthy, before you experience any medical scare or any medical illness. And if you came and you're concerned about paying for healthcare expenses in retirement, you're definitely not alone. Many of us, many Americans share your concern. In fact, research shows that 66% of working Americans surveyed are significantly concerned about paying for healthcare in retirement. Now, here are some costs, especially costs that later in retirement that can erode our savings. We're talking about assisted living and nursing homes, home health aides. So here are some examples of the costs for individuals. As you can see on my screen, the median expense for assisted living here is it's a little over $6,000 a month. Now, if we look at nursing home, it runs close to 11,000 per month for a private room. And then if we consider maybe home health aides, or they are paid at least $6,500 a month. And the average monthly healthcare premium after the age of 64 is about $1,600. So it is smart to be prepared. Insurance may only be a fraction of, or in fact, let me rephrase that. Paying for insurance may only be a fraction of the cost that you see here that I listed above. So now that we know roughly how much we need to budget for, let's talk about how to cover these costs. And it is a good idea to get a handle on your healthcare coverage options. What insurance options will you have available to you? This is a good question. And here's a high-level view of sources that may help cover your medical expenses in retirement. And we'll touch on a couple of these in detail, such as Medicare and supplemental insurance. But basically, you have three categories here. You have government programs, which may include work-related coverage and supplemental insurance, right? Well, actually, no, let me rephrase that. You have, government programs, then separately, you have work-related coverage and supplemental, and then third, you have supplemental insurance. And government programs, you have Medicare, you have Medicaid, or other plans, such as other plans available to government employees. Then you have the work-related coverage that may be available for retirees as part of your medical insurance that your employer offers. Another opportunity to cover costs is if you have a health savings account, an HSA. Then the last category here you see is supplemental insurance, which many people buy because Medicare doesn't cover all of what you need. So many people purchase what is known as Medigap policies to essentially fill that gap. On that note, let's in fact focus on Medicare here for a few minutes. And by the way, should you want more information about Medicare, especially long after this meeting today, please know that there are plenty of answers and plenty of resources available on the Medicare.gov website. But our first stop is going to be Medicare, which it will cover approximately 2/3 of healthcare expenses. And here's some quick facts on Medicare. You are eligible, or eligibility begins at age 65, and it is not free. So retirees must pay premiums for parts of Medicare. So each person, each of you is covered separately with individual, not joint coverage. So if you're married, it is an individual coverage. You need to think about each of your own needs. And Medicare is designed to provide catastrophic and limited medical coverage. So it's not meant to cover all. It's not meant to cover all of the costs. Now, when it comes to applying for Medicare, and I'll say here that timing is everything. So it is important to enroll at the right time to avoid penalties. For example, if you don't enroll on a timely basis for Medicare Part B, the penalty is 10% for each full year of delayed enrollment for as long as you remain uncovered under Part B. For Part D, the late enrollment penalty is 1% per month for every month without Part D coverage. And by the way, I will explain the Medicare alphabet, the Part B, Part D, in a couple of slides from now. So don't worry. We'll dive into different parts of Medicare. Then you have initial enrollment. Medicare enrollment begins 3 months before your 65th birthday and continues for 7 months. And then you have also the annual enrollment period. And you may be familiar with the annual enrollment period. This is when you may start to see some commercials on TV discussing Medicare and encouraging folks to make changes or it will advertise the annual enrollment period, which goes from October 15th to December 7th. And then you have also the special enrollment periods. And these are going to be certain windows of opportunity to actually get in. Now, if you are currently receiving Social Security benefits, you don't need to do anything. You will be automatically enrolled in Medicare Parts A and B effective the month you turn 65. So if you do not receive Social Security benefits, then you will need to sign up for Medicare about 3 months before you turn 65. And Medicare will send you a letter. With a username and password for the Medicare.gov website. So along the way, you may be wondering, well, what if I'm still working? So more and more people are working past the age of 65. And whether or not you continue to work, you can still get Medicare when you turn 65. You may want to sign up for Part A because Part A is free, but check with your Human Resources office to see if you should sign up for or delay Part B based on how it works with your employer insurance coverage. And then, penalties for not signing up may not apply in this particular case. So certainly you want to talk to HR. And also one point I want to emphasize is what we call the spouse or partner gap. Now, if you are retiring at age 65 and you have a spouse who is younger, only you are eligible for Medicare. In this example, on this example here on my screen, let's say that you're 3 years older than your spouse. So unless your spouse is still working or has other medical coverage, they'll need to buy separate coverage for that 3-year gap before he or she becomes eligible for Medicare. So because individual health care coverage policies tend to be a little bit expensive, this can have some pretty significant impact or implications for your retirement plan. So again, make sure that you're thinking about if there is a space, if you, especially if you're a lot older, maybe 10 years, there's a 10-year gap between coverage, between ages, between you and your spouse, then that can be a significant gap, and definitely you would have to account for that as you think about now getting Medicare. Now, another situation that may arise is the possibility of you turning age 65 and remaining employed. As we just discussed, Medicare will notify you about 3 months before you turn 65. At that time, you would be able to let Medicare know if you have other coverage through your employer. And you should ask your benefit department whether your current coverage will change in any way if you enroll in Medicare, even if it's just Part A, so that you can, again, plan accordingly. So now we'll talk about understanding Medicare a little bit more. With Medicare, the ABCs are not so easy. In fact, the devil here is in the detail, as they say. So here I've broken it down in two different buckets. So we have the traditional package, right? And also Part C, or what we like to call the combined package. So let's look at the traditional package, which is also known as the original Medicare. And so let's start with Part A. So Part A is hospital insurance, right? Part A is hospital insurance. And there's no premium for Part A because you paid Medicare taxes while you were working. So unless you don't have enough work credits from Social Security, which in that case you will have to pay a little bit of a premium, but most people don't. And then you have from there Part B, which covers outpatient services. So Part B is optional, but a premium is required. Now we'll go to Part D, which is prescription drug coverage, also optional, and it is provided by private insurance companies, and it also carries a premium. The national average for a Part D coverage is approximately, well, it used to be approximately $33 a month. Now we're in 2026, so that may be a little more now. But you should know that for every year you delay enrollment past the initial Medicare enrollment period, your Medicare Part D premium will increase about 12% per year. So, and again, I'll say that again, it is important to not delay, right? Because every year you delay, basically your Part D premium can increase by up to like 12% per year. So you will see in the traditional package that Part C is missing. And so Medicare Part C is actually a combination of the other parts of Medicare, including Part A, B, and sometimes D. And so supplemental plans such as a HMO, or a PPO, or even a fee-for-service type coverage, right, is referred to as Part C. Also, you may have heard it be called a Medicare Advantage plan, right? Which is, again, it's another way to say, it's another term for Medicare Part C plan. So ultimately, along the way, you may be asking, well, so which one should you choose? If you choose the traditional package, you may need to purchase what is known as Medigap policy to plug any holes in what Medicare doesn't cover, right? Many insurances, right? You may have to. Medicare has deductibles. Medicare has copayments and coverage exclusions, which you may have to just pay it from your own pocket. Now, some of those costs can be covered by that Medigap insurance policy. So definitely that is something to consider. Or you can go with Part C, which is the combined package, which is more of a all-in-one approach to Medicare. And here's a chart showing the monthly Medicare Part B and Part D premiums. So here on the left, you find, so you find your income level on the left, and you can get a good idea what you might pay, right? And then the plan premiums referred to on the right-hand side of this chart will vary depending on the plan you select. For example, the national average for a Part D premium in 2026 is approximately $46.50 per month, right? And that's the average when we consider the different levels of income here. Yeah, so in between is around $46.50 per month. Now, to figure out which option will work best for you and is the most affordable, you will need to do a little bit of homework. And starting with the Medicare website, it has comparison tools and calculators where you can see what your options are. So now our next stop is supplemental insurance, which we put into two categories here. One is benefits from your employment, and the other is a Medigap policy that you can purchase. So what it comes down to is you may have coverage from your employment, or you may need to actually purchase a Medigap policy to cover what Medicare essentially doesn't. So costs will vary by region. The premiums and the cost of this Medigap will vary by regions. I'll also say that most states do offer Medigap plans, but they are, in fact, most states have the same types of Medigap plans, but there are 3 states that do not. So you have Massachusetts, you have Minnesota, and also Wisconsin, which have their own Medigap plans. And again, it is important to do some research here so that you can determine the best approach for your needs. And now I'll talk about Medicaid and the Medicaid safety net. And so this is where you should know that if you exhaust your resources, there is a strong safety net. So Medicaid is a fallback option. It's a fallback option if you or your spouse or partner actually needs it. And so this is a government program available to all of us if we need or if we should run out of money in retirement and need nursing home care. It is administered by each state, and you should apply if you find that you need that continued care, but you just simply have just run out of assets. And granted, you will have to meet a set of strict rules, and there will be a detailed review of your financial assets to make sure to see if you qualify. Now, the rules are too complex to go through here during this session, but if I just wanted to just remind everyone that there is a safety net should you need it. So our third step here now is saving for healthcare. And we know that healthcare costs, as I've just discussed and laid out for these past 20 minutes, the cost can have a significant impact on our retirement income dollars. That's why it is smart to actually save as much as we can before we retire, before retirement, so that the cost of healthcare won't take us by surprise. And so one of the ways you can do so is you can use the My Orange Money experience, which you may find on the plan website, on your ABA Retirement Funds Program website, to factor in, so that you can factor in healthcare costs into your plan for retirement. And there is and I'll show it here in a couple slides here, where there is a drop down on the drop down menu on the My Orange Money experience. We have a little bit of a calculator there that allows you to actually consider healthcare costs even while also considering the region that you're planning to retire in. But before I show you a little bit more on the MyIrishman experience, I will share with you that we can be smart about healthcare. And there are a couple of ways to keep costs down in retirement. For example, if you may want to identify now the best providers for safe and cost-effective solutions before you need care, right? Which can significantly save you money on your healthcare needs now and also later. So what I mean is identifying a good cost-effective primary care physician, also a specialist, certainly urgent care providers, and even some specialty hospital. Also, to be smart about your healthcare, just don't forget to only use emergency room services for emergencies only. Why? Because your co-payment for an emergency room is usually much higher than if you actually went to a physician, to your primary care provider. And then ultimately is being aware of the costs, right? Being aware of the cost, knowing, having a good idea of exactly how much you're paying in healthcare, so that you may be able to make some wise decisions as you, again, go about choosing your providers. And then ultimately focusing on healthy habits, paying attention to preventive care, and actually always making sure that you actually meet your annual checkups. So all of these things can make the amount you need to save for healthcare much lower. So next, also I will suggest that you consider a health savings account. And a health savings account, an HSA, but also known as an HSA, is a tax-favored account that lets you contribute and save funds to be used towards eligible expenses now and also in retirement. HSAs can absolutely play an important role in saving for future healthcare expenses. But I will tell you that you must be enrolled in a qualified high deductible health plan to be able to open and then contribute into an HSA. So if you or your spouse's healthcare plan offers a high deductible plan, then certainly you'll be able to fund an HSA. And an HSA, you may be thinking, well, why an HSA? Well, you can use the HSA to pay for Medicare premiums in retirement. It is portable. This means that even if you open an HSA through work, the account is basically yours, right? Just like your checking account and your savings account, the account is yours. It doesn't belong to your employer. And this is even if you keep your job or you change jobs, yes, that the HSA still goes with you. Also, you can invest your HSA funds, also giving you the opportunity to earn money with the money you already set aside for healthcare expenses. You may be able to grow that money in your HSA account. Now, granted, I will say that we remember that all investing involves risk and fluctuation of prices and uncertainty and changes in rates. But certainly, again, you are able to invest the funds in your HSA account. Now, what's more is that HSA, it offers a triple tax savings, right? The beauty of HSA is that it has a triple tax treatment here, where the contributions are made on a pre-tax basis. Any earnings, any growth, and distributions when you pay for eligible medical expenses are tax-free for federal tax purposes. So, in other words, it's non-tax, so it's pre-tax going in, is tax-free while in your HSA account, and then also tax-free when you take the money out to cover medical expenses. So it's a very efficient way to save for your medical expenses, especially in retirement. And then there are other retirement saving options. Certainly, if you have other accounts, such as an IRA, or maybe other accounts that you have earmarked for your medical expenses in retirement, and that works too. And if you find that you've contributed for an HSA, and you kind of reach that max, but you're looking to even put more money into your HSA, then if you are 55 plus, you can make an additional $1,000 catch-up contribution to your HSA. So now with that, we will come to our last step, which is to have a plan. And the first stop here is to essentially head to the ABAretirement.com plan website, the ABA Retirement Funds Program plan website, where you can find many articles and tools and calculators to help you learn more about and plan for healthcare costs in retirement. In addition, on the plan website, once you log in, you will find a financial dashboard that can bring together your financial life. You can connect external accounts like checking accounts, credit cards, savings accounts, and more along and in your account to essentially be able to have a comprehensive view of all of your finances, all of your accounts, all on one screen. In addition, also, you will find that once you add all your accounts, you will gain some financial insights, right? You will have view of your entire net worth, your spending, and also it has a built-in budgeting calculator tool there so that you can, again, keep track of your finances and distill any complex financial information. You can understand better your finances and gain some insights. And then we have the My Orange Money experience. The My Orange Money experience, I mentioned this earlier, where for one, with the My Orange Money experience, you are able to essentially consider the impact of your decisions. Consider the impact of saving for retirement, but also you can also see the impact of healthcare costs in retirement. Here, the My Orange Money experience has a drop-down tool, has a drop-down option here, where you are able to consider healthcare costs. It's built in right in the My Orange Money experience, so that you can determine what costs might apply to you, what healthcare costs might apply to you in retirement. And then moreover, you also are able to schedule a complimentary appointment with a financial professional who's able to provide you with some insights if you have questions about on reaching your financial goals. Definitely, we are here and able to provide that assistance. Again, you can schedule a complimentary review over the phone so that you can discuss your retirement readiness, especially if you're getting closer to retirement and you're getting closer to making financial decisions. And you can do so by either scanning this QR code. As you see on my screen, this QR code does work, or you can also type in go.voya.com/ABA_RF1. So here are some key takeaways, and thank you for joining me today on this session. As you can see, there are many considerations that affect how we make the most out of our benefits. So if you're able to, it's always a good idea to log in into your ABA retirement plan account. And there you will find, again, some really good tools and calculators so that you can consider different scenarios and make some informed decisions. Also, as a quick reminder, that you can go to the Medicare.gov website to learn more. And from here, I would say to play with what if scenarios. So thinking about the different factors that come into play in retirement, right? And from there, you can consider and evaluate all of your options as you are making decisions, not only for healthcare, but well into your retirement. And then from there, I will also say if from there you have questions, definitely you want to reach us, consult with a financial professional to get assistance and some insights. Thank you so much, everyone, for joining this session.